So I kind of want to start with where we're up to and start with a bit of the end in mind of where we want to get to. And this is going to echo a lot of what you've already heard to date and reinforce it. This is the data from the Australian Early Development Census, which in Montréal is the Early Development Instrument, exactly the same measure. We have it every 3 years across the whole country in Australia. And so we're able to look at how children are doing. And you can see here the proportion of children who are developmentally vulnerable on one or more domains at school entry between the most disadvantaged area at the top and the least disadvantaged area at the bottom. And I think you can see really from the back of the room that we have been substantially and significantly unsuccessful in closing the equity gap since 2009. And at some stage, you got to kind of say business as usual is not the way to go forward, because what we know from here is it's pretty much the way the children continue over their lifetime, except that the inequities get worse throughout schooling. And so today I want to just spend a bit of time going back to, what is this kind of all about? And what are the sorts of things that we can do? And I'm going to flip in and out of this idea of poverty, investment, and stacking. So they're the words I'm going to talk about today. So the first is, and you've already heard this, I just have it up there. We know the first 1,000 days are really important for brain development. That's all I have to say to this crowd. The second is the cost of late intervention. You've already heard about it. In Australia, interestingly, it almost is the same cost, $16 billion for late intervention. This is some work that was done just showing what are the costs to society, which should make us all sit up and say there is almost nothing you can spend up front that is too much when you're spending $16 billion a year on late intervention. This is some work from Anna Price. Anna, put up your hand. This is Anna. Anna's one of our wonderful researchers at the Centre for Community Child Health, and I also have my PhD student, Ashley Shipton, here. And I'm very proud because we have 2 Melbourne people who have come all this way. So, and they're having an absolutely fabulous time. So Anna's doing quite a lot of work looking at the relationship between particularly looking at poverty and outcomes, but really interested in what happens when families have children and this actual drop in outcome. They call it the pregnancy penalty, mainly worn by women. And the 2 lines that you can see there, and I'm sorry the lines are actually missing out of the bottom there, and so Anna, I think I'm interpreting this right, so let me know if there's a problem. The top line is what the poverty rate would be without benefits, and the bottom line is the poverty rate with benefits. So it's good to know that we have benefits in Australia that ameliorate the poverty gap. But the one I'll take your attention to is this middle one here, which is what happens for one-parent households, predominantly, obviously, female households, and how high the poverty rate, that is what you're seeing, between 30 and 40% for women after they have a baby. So there's a real need to address some of these issues very early on. The next things, I put this in after hearing some of the conversations. This is some work that we did a little while ago, trying to look at what is the kind of impact of disadvantage on the 0 to 2-year-olds if you were to take into account disadvantage at 4 to 6. In other words, if you pretended that those children did not have disadvantage at 4 to 6, so you were just particularly looking at disadvantage at 0 to 2. This is a mediation analysis in 2 cohorts. All these slides will be available, so you'll be able to look it up. But what's really interesting here is that disadvantage had an impact at 0 to 2 on cognitive outcomes, but not on non-cognitive outcomes, which I think is interesting when you're hearing about some of the talks that we're hearing. And we've done some other work on this as well over the lifetime, and it does look that non-cognitive outcomes, particularly social and emotional outcomes, seem to be more proximal to the environment that children are in, as opposed to cognitive outcomes, which seem to be laid down much earlier in life. And then, of course, we've talked about the social determinants of health. I've been showing this slide a lot, and it's a bit of a light globe moment for a lot, not for you guys, but for a lot of people who see it. It is data from WHO. It is not child-specific data. It's Western European countries, but it's looking at what's actually contributing to the health equity gap. This is a slide that was shown by the Futures Commissioner from Wales. We heard this morning about the future commissioning legislation that they actually have in Wales. We're proposing we should do that in Australia. I suggest we might want to do it in a number of our countries. Anyway, this is her slide, just recognising where it came from. But what I love about this slide is it really shows you that health services only contributed 10% to the health equity or inequity, I should say. And so we all kind of know this, but I find this really powerful because it helps us understand what are all the other things we need to be doing. So I want to talk about COVID for a moment. It's amazing that we have this ubiquitous exposure to the entire world. Like if you stand back and think about it, what an extraordinary thing. But we all experienced it differently. In Melbourne, where I live, we were the most locked down city in the world. Yay. Nothing like the ticker that comes along the bottom that says, by the way, you're no longer allowed out of your house after 8 p.m. That was a great moment. And a couple of things emerged out of this that was a real wake-up moment to me, and why I want to sort of pivot the narrative from a poverty narrative to an investment narrative, because I'm actually worried about the poverty narrative. At least in my country, it's getting very little traction. And I wonder if we just focus on poverty, whether we're just not focusing on enough children. And this was one of these moments. This was a survey that was going on every couple of weeks throughout the pandemic. I think you can see the years there from June 20 to September 21. And this is adults who had children less than the age of 5. And they're reporting on whether or not they felt financial stress. So this was the dark blue lines are financially stressed, and the light blue lines is just making ends meet. And you can see how it's tracking along there all those years. A little bit of the blip was we sort of gave people more money, everything got better, and then obviously it just went back again. And we're more and more convinced this was probably a pre-pandemic phenomenon. We just never measured it before. And then when we started measuring, we went, holy manoli, there's about, 40% of families who are financially stressed. But the thing that I'm really interested in is 70% of families, this is pre the cost of living crisis, 70% of families are just making ends meet. And then you start thinking about, wow, is the poverty narrative enough really to make a difference to the children under the age of 5, when nearly 70% of families are saying they're just making ends meet? The other kind of narrative, and again, this is some of Anna's work that will hopefully get published soon. The other part of the narrative is that was happening during COVID. And again, I think part of this is we were just measuring things that we just weren't measuring pre-pandemic, is the difference between low and high income on maternal or parental mental health, mostly maternal, and the idea of deprivation. We've been doing a lot of, well, Anna at least has been doing a lot of work in deprivation. And you can see that if you have deprivation, you're much more likely to have poor mental health, and the same thing if you are low income, which are the two red lines. So we've kind of got this convergence of families really kind of struggling to make ends meet. And we've got higher levels of parent mental health at the very time when we know brains are developing. And so the question is, for families, what are the sorts of interventions that we could do that are likely to make a difference? And you heard before my comment about this can and will kind of nature of the policy environment subsequent to COVID. So the question is, what should we do and what could we do? So let me start with what I think we could do if we're actually going to make a difference to equity. And this is a very equity-focused talk. So I'm really talking about equity here. So the first thing is to maximise the current system. So this is a very interesting journey. This is a program called Healthier, Wealthier Families that now Anna is leading, but it is actually based on a Scottish program that we heard about during an ISOF meeting, actually. So very interesting, and it's such a great narrative. There isn't a person who doesn't love this narrative, and if you want to know more, when you see their slides, you'll see there's a lot on the web. So it's just fantastic. It's basically saying, can we take our universal, non-stigmatising health services, either antenatal, primary care, we have nurses, and can we get them to ask families whether or not, a series of standard questions, whether or not they're at risk or in poverty? And it's so simple. And there was a report from Australia that suggested that there were particularly non-English speaking families and young families were just not getting their entitlements. So how fantastic, this non-stigmatizing front door, asks families about this, and then the nurse has a relationship with the financial counsellor, and there's a warm referral to bring the financial counsellor and that family together. And there's a whole lot of benefits to this that Anna can talk about, but it's amazing because we've brought the prevention literature and the prevention language into financial counsellors. Financial counsellors tend to be ambulances at the bottom of the cliff. Oh my goodness, you're about to lose your home, car, life. Let's drive in and, you know, put you into financial ICU. This is all about prevention and all about getting the things that you're really actually entitled to and helping families feel better. And this is the actual fun part. So the least fun part is don't try and do an RCT during COVID. That is the moral of the story. However, Anna kept going. And so instead of doing an RCT, we did a feasibility study. And this is the mind-blowing bit. So you can see those numbers are real, an average of $6,500 more in benefits that those families were entitled to anyway. And including non-English speaking families, and you can see how much money that is per week. So this is, for those of us who work in the kind of give people money world, you'll know there's a lot of moral outrage when you start suggesting that people should actually have more money. You get a lot of paternalism. Why can't they just pull themselves up by their bootstraps? It's for another conversation. But this is a really great conversation because there's no moral outrage. This is money that these families were entitled to anyway, that were already in the budget because the budgets get set according to the people of need, not who actually claims those entitlements. And the cool thing about this, I think you can sort of see the little dots on the picture of the world, is there's our collaborators in Sweden, in England, as well as Scotland, New Zealand are interested, and we're in 2 cities in Australia, and we're hoping someone from this wonderful province might be interested, and hopefully from Ontario as well, because you have these universal systems that could potentially capture these families. So this is really cool. This is about giving money to people without having to model it, without having to do anything else, just give families money that they're entitled to anyway. So the second idea is, so I've been sort of obsessed also about this idea of why can't we just give people more money? And you've heard all about that. The first solution is stop people being poor. So there's another project which we're running called Changing Children's Chances. And you probably don't know this, but this is a multidisciplinary group that's been working together for some time, looking at how do we use existing data to actually model policy interventions. And so these are all the people. I just want to particularly call out Margarita Marina Betancourt. For those of you who are into statistics and epidemiology, you might know her. So she's been a great lead on this work. And again, I put the website up there so you can have a look with all the papers. So we thought, let's try and model giving people money, because I'll get to part 3 about actually doing the experiment, but let's try and model it in Australia using an existing cohort where we modelled and actually pretended we were giving people a supplemental household income and see what that does to the inequities in outcomes. So this is the kind of what if. It's a target trial analysis. If you want to know the details of it, it is in the paper. It's published in Social Science and Medicine. I can give you the high level details. I cannot give you the proper statistical details because it's out of my scope of practice. But this was a really interesting one. So this was, what about if we model giving people money? And we chose $26,000 Australian, which is, you'll recognise, about $500 a week. And the reason why is that's what we gave families during the pandemic. So the question one should ask is, if you can give it once, why can't you keep giving it? And we gave a lot of families $26,000 a year. And then we said, okay, what effect will that have on parent mental health? Because the hypothesis is the impacts on child development are actually mediated through the family. And then what does that actually do to children's learning, physical functioning, and social emotional adjustment? So the first thing is I just want to give you the distribution of each of those outcomes, and just to orient you to this slide, the blue slides, and this is children doing, these are problems in parent mental health, etc. The blue bar is those families with the lowest household income, which was less than 56,000, and the highest household is 99,000, which is the yellow bar, and then everything in between. Remembering we were trying to look at what about if you give people money right across part of the income spectrum. We didn't want to necessarily just focus on the lowest. And you can see social gradients are well and truly alive. And you can also see the differences. And it was these gaps that we were interested in. The gap, for example, in the learning competencies between 21.9% of children having problems versus 10.2% of children. So that gap is what we're targeting. Now, this is a bit, it's sort of a complex slide and sort of not, because it's all about patterns. So the light confidence intervals that you're seeing there are kids who were not eligible. In other words, their parents earned too much money for them to be eligible for receiving an income supplement. And the ones on the right are the before and after interventions, dark before and then lighter after. And then it's for each of the income thresholds. So you can see pattern-wise that children actually benefited from receiving the income supplement and are kind of at every level. So it's not like we saw massive benefits for low-income families and no benefits for higher income families between 50,000 and 100,000. We actually saw kind of benefits everywhere. And again, this gets to my point of is poverty the right narrative, or is investment the right narrative? And so this is what we did to the equity gap. So there's a couple of lessons here. So you can see the equity gap improved by these amounts. These are relative improvements for each of these outcomes for the children and for parent mental health. So that feels pretty good. We're closing the equity gap. But we're all pretty good mathematicians here. It clearly does not close the gap completely. I think in my mind, I was thinking, give people money, we're done. And it's not the case. And I want to talk a little bit about what we might need to think about, because if we rest on our poverty or our income laurels, we are actually going to not address the equity gap for children. So the third thing is, should we just do a trial of giving people money? And I know Kitty's in the audience, she's done a whole systematic review on this, and you might actually argue, like, oh, for goodness sake, we know that giving people money makes a difference, but it doesn't always make a difference to Treasury. And even though we modelled, what we can't model are those trickle-down effects that you heard in the last session, because people make certain decisions when they're given money that we simply cannot model. And so the idea was, can we do a randomised control trial of giving people money? And we have this giant cohort we're developing in Victoria, which I can talk to anyone ad nauseum about, called Generation Victoria, where we've recruited the entire state into a cohort. We've got about, at the moment, 50,000 babies and about 70,000 parents. So it's pretty exciting, but it's a platform then for doing randomised control trials. So the question for us is, can we do this trial to actually see whether or not it makes a difference to parent wellbeing, parent employment, and outcomes for children? And you'll note this is a very expensive trial, but we're trying not to target the very, very poor, but take it right up to the bottom 50%. What about if we gave the bottom 50% of families more money? So back to what should we do? What could we do? So I have some provocations that I want to end with. One of the things Liz and I talked about was at the end of this, you're going to have the QR codes and opportunities for questions. And I really want to see what people think about some of these provocations. So the first is cash the solution? Or maybe is cash the only solution? Anna and I did this episode for Nesta, and I think it's really interesting, those provocations, because I know I'm stepping into the fray a little bit. I certainly think cash is part of the solution, but I worry if we just hook all our effort into cash. And this is why there is just no silver bullets if we're going to make a difference to the equity argument. And we're seeing this more and more. The work that I showed you with Changing Children's Chances, we've looked at different policy levers. We're about to try and look at about 5 policy levers and seeing if it closes the equity gap. But if you, you know how you have these moments and you think, why did it take me so long to have this moment? It doesn't even make sense, does it, when you stand back to think that with these complex families and the inequity and the complex lives, that if we just do this one thing, that's going to eliminate inequities for children. It doesn't even kind of make sense if you know anything about child development or parents or families. And so I think the onus now on us is what's the right stack? What are the sorts of things that we really need to bring together? Because no matter how good all of the things we've talked about even today, and I've done sustained nurse home visiting, they don't close the equity gap. They nudge it, but they don't close it. No matter how good it is, they don't make those children look the same as the most advantaged children. And in fact, this is also from Changing Children's Chances. We've tried to take a social determinants lens to disadvantage. Mostly when I say to you disadvantage, you're going to think your mental model will be socioeconomic disadvantage. But actually disadvantage wears many hats. And I think it's really important when we're thinking about children and families. You can see this is trying to take an ecological view, but also a kind of social determinants view. So look at socio-demographic, geographic, risk factors and health conditions. And when you put all of those things together, there's a lot of children living in some form of disadvantage. And when you model making the least disadvantaged children and the most disadvantaged, or the most disadvantaged children look the same as the least disadvantaged children, you have the problems for children. And again, I think this is really interesting. Halving the problem is a big deal, and it's a fantastic thing, but we don't get rid of them altogether because there still is genetics and all the other sorts of things going on. But again, it's taking us away from just kind of silver bullet mentality. And I think I've time for a minor whinge, which is this kind of, let's do a single program and scale it. And this happens a lot in low and middle income countries. And I was talking to Arju before about some of the work that he's doing, and we just kind of lament this, take the program and scale it and we're done. And it's just not, systems change does not work like that. And for a longer conversation about systems change. And then what's an early childhood talk without quoting James Heckman? I didn't quite know what Pierre meant when he said colleague, so I'll leave that one alone. But he's been talking a lot about this work about how do you build social capital and human capital, and this idea of if we're actually going to make a difference to adversity, we have to have this kind of continuity and complementarity of services. And we've been thinking a lot about this in terms of what that might look like. And then I thought I'd share this with you. It's a recent article from the Mandarin, which is a political sort of policy sort of mag, but I just loved it. Like, money is the universal lubricant for delivering programs, and everything is easier with a sufficient budget allocation. And he's put this in a policy journal, and I just kind of loved it, because what he's really talking about is we just don't invest in prevention, and we don't put money even into the programs that look like they might work. So we're great at taking reasonably good programs and delivering them badly. And, you know, childcare is one of those examples. And then finally, this is kind of our pièce de résistance. You know how you're going to go, let's put everything we know in one slide and color code it and see what people think. So we've really been talking about this idea of stacking interventions. What are the right interventions for the right children at the right time? A kind of policy, precision policy approach. Now, if you have a look at all of those things, you're not going to look at it and go, oh my goodness, I've never thought of quality preschool programs before. Everything that you'll see on there is things that you've been thought about, but we rarely think about them all together. And certainly from a policy point of view, they're really implemented all together in high quality, delivered to people with the right quantity, quality, and the right people coming. And we've been thinking more and more, how do you build this stack? How do you build these stacks in communities for families so that they're actually getting all of these things, and the focus, the parent voice focus, which you're actually going to hear about in a moment from Josie, is not about whether or not you should get antenatal care, but it might be how you implement it. And I think we've conflated what's an evidence base with how you implement things. So this is our kind of, this is our goal now in trying to, and you can see it goes right up the whole ecology, including housing, parent income, etc. So this is how we feel on any particular day, somewhat overwhelmed, And I think we're meant to. I think we're meant to sit in the complexity and feel this way. But I want to finish with this. I use this slide a lot and I really like it. And the reason why is a couple of things. Don Berwick, for those of you who don't know, was kind of the early guru of quality improvement in hospitals. And he brought quality improvement in because we're busy killing people. It turns out it gets a lot of attention when you kill people. So, you know, you've all heard the stories. We cut off the wrong arm, we left the surgical stuff inside, and it really drove quality improvement. And I think that's just quick deaths. I think for children now, we're having slow deaths. And I feel that the people in this room are the future leaders. So I want to read this because it's a call to action. It is the burden on good leadership to make the currently unthinkable thinkable, to question the obvious, to make the present systems unavailable as options for the future. The boundaries in our minds create fear about the consequences of crossing over to the undiscovered country, but the possibilities we really need do not lie on this side of our mental fences. And once crossed, these fences will look as foolish in retrospect as the belief of other times now often look to us. And that's my final slide. I think I was kind of on time.
So any comments, questions, ideas? This is extremely stimulating. So the major provocation, the first one, is cash enough? Is cash enough? One vote for no. All right. There we go. Yes. Necessary but not sufficient. For love.
So that was excellent, by the way. Thank you. I was just wondering, what do you think about the big RCT that's ongoing in the US at the moment, where they're just giving cash babies' first years, and it's it's causing a lot of controversy, I guess, in that they're not finding any effects, right? At least the early findings, like it doesn't work. And I want to know then, in your trial, are you doing something different in your trial to make it different from babies' first years, or not?
Yeah. I think there's a couple of things in that. So first of all, they're targeting very poor families. So we're trying not to. So you might argue have less effect. The second is, I'm not surprised, because I think a lot of the effects are latent. If you think about the poverty, it's actually what is it doing to families and to parents, depending on the kind of theoretical construct, and then how does that translate to impacts on children, and then how do we measure that? And measurement in young babies is just fraught. So I feel it's too early, but we're also thinking about, wouldn't it be cool? So we have our own sustained no-site visiting. We've just had a whole, ceremony about meeting each other's sustained no-site visiting programs during the break. Wouldn't it be cool to add that in as well? And then what else could you kind of sneak into a stack that wasn't the full stack, because that's quite complex, but to at least try something. So I would love to think that. And we may not get this up, of course, because it's highly expensive. But yes, you're right, it has been. And again, I think it's highly targeted in a country which has very poor public benefits.
I have another question. I really appreciated the graph where you tried to put everything in there. But I guess my question is, that can either be a pie in the sky, or it can be something that we actually want to achieve. Could we actually create this nirvana for children and, demonstrate that it has an impact? And if so, what are your thoughts on that?
What a good question, Liz. So I was saying, when there was the Lego call, remember there was a huge Lego call, and we put in this whole thing like this. So we sort of hypothesized, what if you could do 10 things in a community that you really know are good for children, but all the way up the ecological tree, like not 10 services, but some core services, looked at the built environment, and you actually got enough money to build those 10 things. So not like most of those things, by the way, are all part of the core system in some shape or form, but generally delivered poorly. So what if you get enough money to really deliver them? That was like one bit of the 10 in a community. And then the second bit is, what about sufficient manpower for co-design for implementation. So I'm going to be provocative again. But my view is we do not fund any of these implementation efforts with the right amount of resourcing for success. So we kind of have this, we'll give you 5 cents. And by the way, can you actually revolutionize your entire community, maintain it, do it all? And then, oh, look, that didn't work. Sorry. And then we'll take it back because nothing happened. Exactly. Whereas if you think about the way, I would say to people, if I was Coca-Cola and I wanted you to drink Coca-Cola in your community, I would front end that investment. I would know the data. I would know what people drink. I would work out where everything is. I would really front end my investment, but we don't do that when we're trying to change systems. We have this kind of eke out. So I think we actually do most of this stuff and set people up to fail. But what if we didn't? What if we really put in the investment up front to succeed? And I think this is the nurse home visit, or the home visiting program was a great example of that. When you really throw things at people, it actually makes a difference. And the third bit, which is my total passion, which I would geek out for hours and bore you all, which is enough data and indicators to drive system change. Like if you run a business, you would not run a business the way we run our human service system. You would know every day what your data were, you would use that data to course correct, and you would make sure you are running the highest quality to have the greatest impact. We do not run our service systems that way. And then we go, oh, I wonder why we haven't made a difference. So I think we could do that with enough money. And I think we could run it as a trial and run it in certain communities and others not, and see if we make a difference. That may be stupid, maybe utopian, but I feel that it's within our lifetime we could do it, and there's enough money in the funding system to be able to give that a go.